Lamini. Go ahead.
Thank you very much, Adelad. So Adelad for Zambia under the Ministry of Health. My comment or question is to Professor Latif Sheikh. That was a lovely presentation. I think your presentation was easy to follow and relate with, and you highlighted a lot of important challenges that we are facing here in Africa. And I was very encouraged to see how CDC is prioritizing mental health and the welcome and invite for mental health ideas and implementation. Just to mention, you highlighted aspects of policymakers, support, buy-in. At least I can confidently say that for Zambia Ministry of Health, the policymakers have really been positive, influential, and they're really supporting mental health. Though, as a lot of us will agree on this platform, when we talk of health, I think there are a lot of competing needs in the health sector. And I'm sure that's the reason why mental health for a long time has been sidelined. Of course, there are issues like HIV, TB, which are highly followed, and recently the COVID-19 pandemic. So you spoke to the fact that we should adopt approaches when it comes to various member countries to the CDC, which I think is a very good approach. I think adoption and consideration of various needs of member countries is important. Though I would like to ask, as CDC, how flexible are you with that? From my little exposure, I would notice that a lot of your funds are very specific to their need or to what they're speaking into. So which provides a challenge for one to use those funds for certain mental health activities, which again, I understand why maybe that is that way. Though talking about the principle of flexibility and adopting to the member states that you highlighted, how flexible is CDC to allow member states to redirect funds to do with mental health in a manner that they feel is of priority to their nation? Allow me to just give a certain example. Maybe recently, again, I'll say I might not have the idea, the whole round picture idea. Though you'll find that maybe you would want funds for certain mental health activities, but you find it is related to HIV only, or it's related to COVID-19 specifically. So, but you are trying to achieve more, and you find that these conditions just highlight the mental health issues that are already there. So how flexible is CDC with ensuring that? And also just to mention, I'm actually a psychiatrist, so I'm also a clinician practicing in the mental health as much as I'm doing administrative mental health tasks. Yes, that's to Professor Latif Sheikh. Thank you.
Okay, thank you very much, Dr. Francisca Boya. This is quite insightful. Your experience in Zambia as a mental health focal person, it's quite good to hear what you are doing, and to hear that there is a significant political will in Zambia to address mental health issues. This is good to hear. And I mentioned the issue of, for funders that direct funds to certain specific clinical conditions or certain targets. And many a times, especially funders from the Western countries, can be very rigid and insist that this is what we are doing and this is what we want you to do with the fund. And I gave you an example that up till probably a few months ago or a year ago or so, it was difficult for countries to even use fund meant for HIV or tuberculosis to deal with mental health within HIV and tuberculosis. That's to that extent. Not even talk of, dealing with mental health outside HIV and tuberculosis. And we do know that mental health issues are quite embedded within HIV and tuberculosis and other conditions like that. But for Africa CDC, I think the approach is a little bit different. The approach is about supporting member states to be able to deal with their priorities. So Africa CDC is not likely to set your priority for you, but is here ready to support you on how to deal with those priorities. And of course, you will not do it without planning. You will not do it without submitting what you want to do. Africa CDC will look at it. Africa CDC itself doesn't have the fund, but will be able to advocate for funds for you in case you don't have. And if you have, it will give you the technical support to be able to deliver whatever you want to deliver within your country based on your own priority. So Africa CDC is not rigid. Like you said, Africa CDC is quite flexible to member states' demands and prioritized mental health interventions. So this is the way I can respond to your question. And I'm sure we are going to meet, and we'll be meeting many times from now. But let's be rest assured that Africa CDC is very flexible in supporting member states to be able to address their prioritized mental health needs. Thank you.
Thank you very much, Prof. Glad to hear that. Looking forward to more interactions.
Thank you, Dr. Francisca.
Yes, let's give the floor now to Nontobeko Dlamini for his question.
Good afternoon to everybody. I hope I'm clear. My microphone is problematic today, sorry.
We can hear you very well.
Oh, thank you. This is Nontobeko Dlamini from Eswatini, the Kingdom of Eswatini. I'm currently the chairperson of Eswatini Psychology Association. Thank you so much for this very, not just informative platform that you've given Africa CDC, but this is coming from a country that is resourced on a lot of things, especially within the health perspective, but more so within mental health perspectives. I'm just here to not only engage Africa CDC, but to also just perhaps be a thorn in asking, I'm not sure who this can be directed to, but I really am looking into what is being done or what more can we do in terms of the misdiagnosis of mental health related to the fact that mental health is also, just as one of the speakers has spoken, that is transactional. And what my experience has been as a psychologist, and I'm an industrial organizational psychologist, a lot of people spend time in the workplace. And what is coming up in the workplace is a lot of people are being affected by their spiritual, I would say, spiritual side and dimension. And it is manifesting a lot of times as if it is, I would say, for example, it has similar manifestations, like it would be depression, bipolar disorder, but there isn't much research that has been done, and that is on, I'd say, Emaswati, but also on Africa at large to do that. Spirituality and not religion, because religion is something that I believe now is becoming or being, I'd see it as a limitation on what mental health diagnosis is all about. Spirituality, I'm referring to where a lot of people, I'll speak to Emaswati, are now coming up to HR practitioners and requesting for leave because they've got a spiritual calling. And I think that is also a sphere that has not been, I'd say, explored enough. And I really would like to see more work in that. I personally would love to embark on that actually for my PhD, which I plan to be doing. And I'm looking for supervisors, and I'm looking for institutions that are willing to host me for this, where we are now facing a number of people that have spiritual callings in quotes, and I'm going to put it in a quote. It's spiritual callings, for lack of a better word. And I would like to look at how mental health for Africans now needs to be decolonized and start looking at it from the perspective where we are all actually cognizant of the fact that African spirituality does exist. And it is not within the context of just religion, it is spirituality. And however, I will also raise my concern that it is such a sphere that does not have governance at times. There isn't, I would say, something tangible that can be used, or perhaps the approaches for tangible ways to test or to assess, for example, to see that a person has a spiritual calling or it's a manifestation of a spiritual calling, but it is just appearing as a symptom of bipolar or depression or all these mental health disorders. So there's that gap in misdiagnosis of mental health. And I'm just looking to say, I would like to really work with Africa CDC in exploring that, so that if we are to speak on issues related to having a strategic plan, having that implemented.
Thank you, Nontobeko. Let me allow the speaker to talk to address your. It's a comment, right? Prof. Latif, for any of the speaker. Then we move to.
Okay, Prof. Latif, you can go and then I can add.
Okay, thank you. Thank you, Dr. Dlamini, for sharing your experience and understanding of various interactions that occur that could make a diagnosis of mental disorder quite difficult within the continent. I agree with you, sometimes it could be very difficult to segregate very well between our spirituality and what we call mental illness. I want you to also understand that there is a lot of diversity on the continent, from north to east to south to West Africa to Central Africa. We have a lot of diversity, and there is a lot of interplay between our traditions, our culture, our religion, and spirituality. And all these things, all of them function at different levels. And all of them have relationship with our mental well-being, our wholesome well-being. So we cannot actually separate it from evolution of our own well-being, evolution of mental illness, resolution of mental health symptoms, healing from mental disorders, and guaranteeing that we have a very good prognosis after we have suffered from an illness. So these are very important contextual things that we also need to ground for different member states, and different member states will have different approaches to this. However, like I said earlier when I was speaking, addressing Dr. Francisca's question, Africa CDC has the capacity to support each member state technically how to develop its own framework to address these particular issues. Unlike before, that will just bring something and drop for you and say, this is how you are going to do it. This is how you must do it. So every country has its own context of the interplay between illness and our sociocultural tradition, religion, and spiritual, values. And so whatever you do, we are ready to support you. Thank you very much.
Yes.
Thank you, Professor Latif.
Okay. Yeah.
Sorry, Dr. Adelad. So, Dlamini, thank you for your comment and your concern as well as your view. One of the key things that we have been addressing is that we have to look at it from the African context and African-centric view. And yes, religion is very different from spirituality. A key element that we are understanding in the field of mental health is what we call transcultural psychiatry. So transcultural psychiatry is a field that actually looks into exactly what you are saying, to say there are individuals that believe in spiritual attacks and spirituality that affects their well-being. Your view about how is it that we can do research as an African context, and how can you work with Africa CDC? Just to communicate with you and all the other speakers, just a week ago, as Africa CDC, looking at the strategic plan, we did meet with a few member states, 27 to 30 member states that were discussing all of this that you have actually brought to the attention. And we're actually looking at how to offer technical support and also other means. Your specific concern was also, you are looking to do research and you're looking for supervisors. And this is exactly what Professor Latif and other specialists on the continent are available for through Africa CDC to offer technical support and bringing this perspective in light. Over.
Yes, thank you. Thank you so much, Dr. Dalal and Prof. Latif, for those insights. So, Dorothy, I've seen you put your question in the Q&A box. Okay, so Dorothy has asked on how does the Africa CDC strategy address training to strengthen mental health workforce?
And maybe 1 or 2 years to train mental health nurses. No, it means the existing healthcare workers that are available at health posts and health systems can be trained in basic mental health support structures that are tailored to our continent, with key indicators being the key diagnoses and the criteria that are available. So this is something that we are currently working on as one of the key objectives of the Africa CDC strategy, which was launched this year, which will run up to 2026. And we will be reaching out to key individuals such as yourself to help us actualize and implement this tailored state, because we also understand that every member state is at a different stage when it comes to mental health services. A few doing slightly better. For instance, Zambia currently, as Dr. Walia mentioned, are doing amazing. We have a mental health focal person as herself, who are actually implementing. And today I would also like to take this opportunity to congratulate Dr. Francisca Walia, who has even launched the treatment guidelines for mental health here in Lusaka, Zambia. So what we are trying to do is, using such treatment guidelines, a country can actually have at primary care level, even a general nurse or a medical doctor who has a basic understanding of mental health can also use those treatment guidelines to actually support and assess mental health services. So this is a vision. We want to see all member states on the African continent be able to reach at least resource limited structures that can actually implement task shifting for mental health at all levels.
Yes, thank you so much, Dr. Dalal, for this insight. And I will really encourage the participant to have a look at the strategy, which is on our website. And you rightly said that one of the specific objective for Africa CDC is really to support workforce for mental health on the continent. And you rightly said that their priority intervention to really come up with a training program that we address. So there's some question in the chat box. Let me allow my colleague Dumsani to bring those. Dumsani.
Thank you, Dr. Adelad. There are a couple of comments. I think most of them are comments and some have already been addressed, but I'll take the comments from Taiwo. The first comment is, making mental health care in Africa Afrocentric will involve, the first one is deliberately and intentionally moving and integrating care to primary and community health care by task sharing. The second one is improving budgetary allocation to both health and mental health. The third one is enacting laws that will make the care of mentally ill more human, empathetic, transparent, with their human rights attended to. And the fourth one is educating the community and the schools on mental health. That's the first batch of the comments. And there was a question, Taiwo, which says, how then do we make our individual willing and those willing backing up the will with actions? I think those are the questions we have.
And we maybe address this question to Dr. Carol. Dr. Carol, maybe if you want Dr. Tani to repeat the question from Taiwo. It looks like, do we still have Dr. Carol?
I think she just fell off.
Okay. Prof. Latif or Dr. Dalal, okay. Reflection on
I'm here and highly experienced. So I believe his questions are based on what is happening in Nigeria. How then do we make our individual governments more willing, and those willing backing up the will with actions? And that's what we're talking about, getting the government to buy in, getting the government to commit themselves, getting the government to adapt the will to be able to do this. And this is what Africa CDC is here for. We have been for over probably 20-something or 30 years running after mental health legislation in Nigeria. And we've been very consistent in the past 4.5 or 5 years, pushing and knocking on the doors everywhere. Now, we are still hanging. And I believe if we had had some organization like Africa CDC that relates directly with heads of governments, that relates directly with policymakers, I believe this will have been a done event. And this is where Africa CDC comes in to provide this support, not only technical support, but also advocacy support for member states to be able to get government willingness to participate in mental health intervention and innovations. So this is why we are actually having this particular forum today. And I'm sure that the director of Africa CDC is with us, is listening to us, and he still has an opportunity to talk to us again on this particular relationship between Africa CDC and members. Thank you very much, my president, for raising these comments.
Thank you so much, Prof. Latif. Dumsani, do we still have a comment or question?
Yes, Dr. Adelaide, we have one question, I think, from Dorothy, which goes, how does the CDC strategy meaning a mental health workforce to meet shortage in the continent?
Yes, thank you for that, Dumisani. This was answered as Dorothy also asked it in person.
Dr. Adelaide, I've had my hand up for a while. I'm not so sure.
Yes, Dr. George, please, you can go ahead. We are wrapping up, but we have 1 minute to for your intervention. Thank you.
Thank you so much. So my name is George Msengi from Tanzania, and quite an honor to get to listen to all of these good presenters. Always a pleasure to hear of the good work that is going on in Africa. But I just had one comment with regards to access. So I think accessibility is still a major challenge when it comes to mental health, and majorly because of, number one, the society norm, especially when it comes to men speaking out. But number two, the platforms that are actually accessible to individuals in the public. For example, a mental health institution, someone just going directly there has a lot of stigma in terms of how the community views them. So speaking about accessibility, I just wanted to share on an initiative actually that we're actually starting here in Tanzania. And we're trying to host an online toll-free calling center, and specifically focusing on youth and adolescents, and trying to link mental health with other comorbidities that face them. So I think this is quite an easy to implement strategy, and I think can be emulated by other countries, but we very much look forward to sharing what will be our findings. So yes, I think the major issue is access, and this can be one of the solutions, can be emulated. Thank you.
Thank you so much, Dr. George, for a great submission. And if any other hands, and no question. And Dumsai, do you have question from the from our social media?
Dr. Adelad, most of the questions that have been asked on social media are almost similar to the ones we have been addressing. So I would say there are no questions, except for one that just came in now asking about the materials that were used today, whether they're going to be shared or not.
Yes, thank you, Adamsan. Yes, we will share the materials that were presented today to all the registered participants. So I think we've now come to an end for this excellent webinar that's really helped us to unpack the Africa CDC plan of support. And, I really want to take this time to sincerely thank the speakers, starting with our director, Dr. Ahmed, who is now unfortunately in another meeting. He will not be able to join us for the closing. And I really again wants to thank Dr. Mohammed Abdulaziz, who is now traveling back to Addis, and who unfortunately couldn't be with us the whole duration of the webinar. But my sincere appreciation goes to Dr. Naim Dalal, who really made an excellent presentation on the challenges and zero in on the Africa specific needs when it comes to mental health. Special appreciation to Dr. Ko, who talked on strongly on prioritizing mental health and the needs to build back better mental health system after this the pandemic. And Prof. Latif Taiwo Sheikh, who talked on how member states can actually benefit from the strategy. I hope that the attendees had opportunity to learn more on our strategy and our plan for the next 5 years. I thank you all for your participation, and please please keep looking at our social media, as we have more activities for as part of this campaign to commemorate this World Mental Health Day. Thank you all, and see you in our next activities. Thank you.